What if I told you that arthritis or even a hip or knee replacement doesn't have to mean the end of intimacy? Far too many men and women silently believe that once their joints are damaged, stiff, or replaced with metal, their love life is over. But the truth is, it's not the end. In fact, with the right knowledge, intimacy can become more comfortable, safer, and even more exciting than before. This is a conversation most doctors don't have with their patients, but it's one that matters deeply. Because let's face it, intimacy isn't just about sex, it's about connection, closeness, and the confidence to feel like yourself again, even in your 60s, 70s, and beyond. Hi, I'm Dr. Emily Carter, and welcome back to Men's Vital Health, Wellness Wisdom, where we bring you honest, compassionate, and science-backed guidance on senior health, vitality, and intimacy. Today, we're tackling a question many seniors are too embarrassed to ask, but secretly worry about. How do arthritis, hip replacements, or knee surgeries affect your sex life, and what positions are truly safe and satisfying afterward? It's a question that combines medicine, mobility, and emotional well-being, because when you're in pain, the thought of intimacy can feel overwhelming. But the truth is, your body and your spirit are far more resilient than you might imagine. Now, let's begin by understanding the challenges arthritis and joint replacements bring into the bedroom. Once we understand the physical realities, we'll walk step by step into practical, comfortable positions that restore confidence and connection. And stay with me until the end, because I'll also share recovery tips, safe movements, and creative ways couples can adapt intimacy so that pain and stiffness don't stand in the way of pleasure and closeness. Part 1. Understanding arthritis and joint replacements. What's really happening to your body? Before we dive into intimacy positions, let's first understand what's actually happening inside your body when you're living with arthritis or after hip and knee surgery. Arthritis, whether it's osteoarthritis or rheumatoid arthritis, is basically a breakdown of the cushioning between your joints. That cushioning is what allows your knees, hips, and shoulders to move smoothly. Once it wears down, movement becomes painful, stiff, and often unpredictable. Now, when doctors recommend surgery, like a hip or knee replacement, it's because the joint has reached a point where it can't support you anymore. The old, damaged surfaces are replaced with metal, plastic, or ceramic parts that restore mobility and reduce pain. And here's the good news. Most people feel dramatic relief from pain and can walk more comfortably again. But surgery doesn't mean your body is back to normal. It means your body has been adjusted. There are new limits, new angles, and new movements that feel safe or unsafe. For example, after a hip replacement, certain twisting motions or wide stretches might put strain on the new joint. After a knee replacement, kneeling or deep bending may be uncomfortable, at least for a while. So why does this matter for intimacy? Because sex, at its core, involves movement, hips flexing, knees bending, bodies shifting. And when your joints are stiff or replaced, those movements feel very different. But here's the encouraging truth. With awareness, patience, and a little creativity, couples can absolutely adapt. In fact, intimacy after surgery can feel more mindful, more connected, and surprisingly refreshing because it forces us to slow down, communicate, and discover new ways to experience closeness. Now that we understand the physical changes, let's talk about the challenges people often face in the bedroom after arthritis or joint replacement, and why so many couples mistakenly give up too soon. Part 2. The real challenges of intimacy after surgery. Once you've gone through arthritis pain or joint replacement surgery, intimacy can feel like a mountain you're not sure you can climb. And it's not just about the body, It's about the mind and emotions too. 1. Pain and stiffness. The most obvious hurdle is pain. Even after surgery, stiffness lingers, and certain movements can send a sharp reminder that your body isn't the same. The fear of pain can sometimes be even worse than the pain itself, causing hesitation and holding couples back. 2. Fear of damaging the joint. This one is huge. Many patients worry that sex will somehow break their new hip or loosen the replacement. In reality, implants are designed to be strong and durable, but there are certain angles and positions that should be avoided. Still, that fear can linger like a shadow in the bedroom. 3. Reduced flexibility and range of motion. Before surgery, arthritis often limits how far you can bend or rotate. After surgery, you might regain some mobility, but not all. This means some positions that once felt natural may now feel awkward or even impossible. 4. Fatigue and low energy. Recovery takes time, and the body needs energy for healing. Many seniors report feeling drained physically and emotionally, which can lower sexual desire or stamina. 5. Emotional distance. This might be the most overlooked challenge. When pain rules your life, intimacy often takes a back seat. Couples sometimes drift apart, not because love is gone, but because touch becomes complicated. And when months or even years pass without intimacy, starting again feels intimidating. But here's the truth. These challenges are normal, and they are not the end of your love life. They are signals, reminders that your body needs a new approach, not a full stop. So, how do we move from fear and limitation to freedom and connection? The first step is understanding which intimacy positions are not only safe, but also comfortable and enjoyable after arthritis, hip, or knee surgery. And that's exactly where we're headed next.
Part 3. Best intimacy positions after hip and knee surgery. Now comes the part most people are too shy to ask about, but desperately need to know. After hip or knee surgery, intimacy is not off the table. In fact, many couples rediscover closeness once pain is reduced and mobility improves. The key is choosing positions that protect your joints, reduce strain, and keep both partners comfortable. Here are some of the best options recommended by doctors, therapists, and real couples who've been there. 1. Side by side, the gentle embrace. This position is one of the most senior-friendly. Both partners lie on their sides, facing each other or with one behind the other. Why it works? Minimal bending of the hips and knees, no weight on sensitive joints. Gentle, intimate, and easy to adjust. Bonus: great for closeness and eye contact or for a more relaxed spooning style. 2. Seated positions. Comfort with support. Try sitting on a sturdy chair, edge of the bed, or even a cushioned bench with the partner straddling gently. Why it works? The person with hip or knee surgery remains supported and stable. Movements can be slow and controlled. Bonus: excellent for those who have balance issues or are nervous about slipping. 3. Modified missionary, with pillows for support. Instead of the traditional form, use pillows under the hips, knees, or back to create comfort. The top partner should keep weight supported by arms, not pressing down. Why it works? Pillows reduce hip strain, and adjustments prevent awkward angles. Bonus: familiar and intimate, but much safer when modified. 4. Reclined positions. Back support matters. Lying on the back with cushions under knees or hips can relieve pressure. The partner on top should move slowly, avoiding sudden twists. Why it works? Supported joints equal less pain. Cushions help reduce stiffness and swelling. Bonus: allows for gentle pacing and easy communication. 5. Standing with support. Using a sturdy wall or counter for balance, one partner can lean while the other stands behind. Why it works? No kneeling, no bending, no pressure on replaced joints. Stability comes from the wall. Bonus, can feel empowering and adds variety. 6. Creative use of furniture and pillows. Think of chairs, recliners, wedge pillows, and even adjustable beds as your allies. These tools allow you to experiment safely without straining joints. Why it works? Support reduces fear of injury, comfort boosts confidence. Bonus, turns intimacy into teamwork. Both partners explore what feels best. Practical tips alongside positions. Move slowly, especially at first. Communicate if something hurts, stop and adjust. Warm up joints with light stretches or a warm shower beforehand. Keep pillows nearby. You'll be surprised how much they help. These positions aren't just about mechanics, they're about removing fear and restoring freedom. When you know which angles are safe, confidence comes back. And when confidence returns, intimacy follows naturally. Of course, knowing the positions is only part of the story. To truly thrive after arthritis or joint surgery, you need to care for your body outside the bedroom too. That's where lifestyle, recovery, and ongoing habits make all the difference. And that's exactly what we'll explore next.
Part 4. Lifestyle habits that boost confidence and comfort after surgery. Intimacy doesn't begin in the bedroom. It begins with how you treat your body every single day. The truth is, the more you support your recovery and overall wellness, the more enjoyable and worry-free intimacy becomes. Here are some essential habits that make a real difference for men and women over 60. 1. Gentle exercise and movement. Don't think of exercise as punishment. Think of it as lubrication for your joints. Daily walking, swimming, or light cycling keeps blood flowing and reduces stiffness. Gentle stretching, yoga, or tai chi can improve flexibility and balance, making movements in intimacy feel more natural. Remember, strong muscles protect weak joints. When your legs, hips, and core are stable, you move with more confidence both in daily life and in intimacy. 2. Weight management. Every extra pound adds stress to hips and knees. Shedding even a small amount of weight can dramatically reduce pressure on joints. Less strain equals less pain during intimacy. You'll also feel lighter, stronger, and more confident in your body. 3. Nutrition that heals. Food is medicine. Anti-inflammatory foods like fatty fish, berries, olive oil, turmeric, and leafy greens help ease joint pain and swelling. Limit processed sugar and fried foods. They fuel inflammation. Stay hydrated. Water keeps cartilage and tissues supple. A nourished body recovers faster and performs better in every aspect of life, including intimacy. 4. Pain and energy management. If pain medications or heat therapy help you move better, don't wait until bedtime. Prepare ahead. A warm bath or shower before intimacy relaxes muscles and joints. Scheduling intimacy when you have the most energy, morning for some, evening for others, makes the experience more enjoyable. 5. Emotional and mental health. Pain doesn't just attack the body, it weighs on the mind. Depression and anxiety are common after surgery or long-term arthritis. Talking openly with your partner about fears or frustrations reduces pressure. Mindfulness, meditation, or even humor can ease stress and increase connection. Remember, intimacy is as much mental as physical. A relaxed mind makes a relaxed body. 6. Celebrate small victories. Don't expect perfection right away. Maybe the first step is just holding hands again, cuddling, or kissing without fear of pain. From there, slowly explore positions and movements. Confidence grows with small successes. Every moment of closeness counts. It's not a race, it's a journey. When you treat your body with care and patience, intimacy stops being a struggle and becomes a natural extension of health and vitality. Now that we've explored lifestyle habits, let's get even more specific. Because hip replacements, knee replacements, and arthritis each bring their own challenges. In the next section, we'll break down tailored intimacy tips for each condition, so you know exactly what works best for your body.
Part 5. Intimacy tips for arthritis, hip replacement, and knee replacement. Every joint problem has its own set of challenges. That's why it's important to look at them individually so you know what's safest, what to avoid, and how to adapt intimacy to your unique condition. 1. Living with arthritis. The challenge: stiffness, unpredictable pain, and inflammation. What works best? Warm up before intimacy. Gentle stretches or a warm shower to loosen joints. Favor positions that don't require deep bending or kneeling. Use pillows or cushions to support sore joints. Key tip: arthritis flares come and go. On good days, take advantage of mobility. On painful days, focus on closeness without pressure. 2. After a hip replacement. The challenge: protecting the new joint from dislocation and strain, especially during the first 6 to 12 months. What works best? Side-lying positions are often safest, less hip flexion and twisting. Seated intimacy with good back support keeps hips in a stable range. Avoid wide-legged or extreme twisting positions, especially early in recovery. Key tip: think small angles, slow movements. Over time, you can explore more freedom, but patience is your best friend. 3. After a knee replacement. The challenge: kneeling and deep bending can be painful or even impossible. What works best? Positions where knees stay relatively straight or only slightly bent. Reclined positions with pillows under the knees for support. Seated intimacy to avoid kneeling altogether. Key tip: protect the knees with soft surfaces. A firm mattress or cushion under the legs makes all the difference. Shared wisdom across all conditions. Always communicate. Intimacy should be playful and adaptive, not pressured. Experiment slowly. What works today may not feel the same tomorrow, and that's okay. Remember, surgery restores mobility, but it doesn't erase the need for patience. Now that we've tailored intimacy tips for each condition, let's talk about something just as important: communication and emotional intimacy. Because the strongest connections in later life aren't just about the body, they're about trust, laughter, and understanding. Part 6: the power of communication and emotional intimacy after surgery. Here's the truth most people overlook. Intimacy after arthritis or surgery isn't only about what your body can or cannot do, it's about the conversations you have, the laughter you share, and the trust you build with your partner. Why communication matters. When you're worried about pain or unsure if a position is safe, silence creates tension. But when you speak openly, "Let's try this," or "That feels uncomfortable," intimacy becomes teamwork, not a guessing game. Honest words prevent frustration, embarrassment, and distance. Breaking the silence. Many couples avoid talking about sex after surgery. They assume their partner already knows, or worse, they believe it's not worth bringing up anymore. But here's the truth. A gentle, open conversation can reignite passion more than any pill. Try saying, "I miss our closeness. Can we experiment together? This feels good, but I need a pillow under my hip. I'm nervous about hurting myself. Can we take it slow?" Simple phrases like these remove pressure and build trust. Emotional intimacy beyond the bedroom. Intimacy doesn't start when the lights go out. It starts during the day. Small gestures like holding hands on a walk, cooking together, or sharing a laugh on the couch build the foundation for a more relaxed, loving connection in the bedroom.
When arthritis or surgery forces you to slow down, it also invites you to rediscover the softer side of intimacy. Kissing, touching, cuddling, all of which matter just as much as the act itself. Confidence through reassurance. One of the greatest fears after joint surgery is not being enough anymore, not strong enough, flexible enough, or desirable enough. This is where reassurance from your partner becomes medicine for the soul. A compliment, a warm touch, a smile that says, "You're still the one." These small things transform anxiety into confidence. The big lesson: the couples who thrive after surgery aren't necessarily the ones with the strongest bodies. They're the ones who talk, laugh, adapt, and support each other every step of the way. Because when intimacy becomes teamwork, there's no challenge you can't overcome. Now that we've explored the emotional side, let's pull everything together. In the next section, I'll share practical do's and don'ts, expert advice, and little-known tips that make intimacy safer and more satisfying after arthritis or joint replacement. Part 7. Practical do's and don'ts for intimacy after surgery. When it comes to intimacy after arthritis, hip, or knee surgery, there are no absolute rules, but there are smart guidelines that can keep you safe, comfortable, and confident. Let's break it down into simple do's and don'ts. Do's. 1. Do use pillows and supports. Pillows aren't just for sleep, they're tools for comfort. Place them under knees, hips, or backs to reduce strain and find better angles. 2. Do warm up your body. Take a warm shower, do light stretches, or use a heating pad before intimacy. Warm joints move more easily and hurt less. 3. Do choose timing wisely. Pick the time of day when your body feels strongest, maybe morning for some, evening for others. Energy levels matter. 4. Do start slow. Ease into intimacy instead of rushing. Let your body guide the pace. Gentle movements lead to better outcomes. 5. Do talk and laugh together. Remember, intimacy is more than mechanics. A little humor, communication, and patience make the journey enjoyable. Don'ts. 1. Don't force old positions. What worked at 40 may not feel good at 70. Forcing uncomfortable angles risks pain or injury. Adapt instead. 2. Don't ignore pain signals. Discomfort is one thing, sharp pain is another. If something hurts, stop and adjust. Pain is your body's way of protecting you. 3. Don't overdo alcohol or painkillers. A glass of wine might relax you, but too much lowers balance and increases risk. Pain meds should be taken responsibly, not used to push through discomfort. 4. Don't compare to the past. Intimacy after surgery won't be identical to before, and that's okay. Focus on connection now, not on old expectations. 5. Don't stay silent. Silence breeds anxiety. If you're worried, share it. If you're enjoying something, say it. Communication keeps intimacy alive. Why these tips matter? These do's and don'ts may seem simple, but they're powerful. They shift intimacy from something stressful into something supportive, playful, and safe. And when both partners feel safe, the spark can shine brighter than ever. So now we've covered positions, lifestyle habits, emotional connection, and practical guidelines. But here's the bigger question: how do you bring all of this together into a real, lasting transformation? That's what we'll uncover in the final thoughts.
Part 8. Final thoughts. Living fully after surgery. Here's the message I want you to take away. Arthritis, hip replacements, and knee surgeries do not end your intimacy. They simply invite you to approach it differently, more thoughtfully, more gently, and often more meaningfully. Your body has changed, yes, but your capacity for closeness, for touch, for connection, that never disappears. In fact,
Many couples discover that the challenges of surgery bring them closer than ever because they learn to slow down, to adapt, and to communicate with honesty. Intimacy after 60, 70, or even 80 isn't about athletic performance. It's about trust, tenderness, and shared joy. When you use supports, when you choose the right positions, when you laugh at the awkward moments and celebrate the victories, you'll find that love not only survives surgery, it can thrive in new and unexpected ways. So don't be afraid. Your joints may be new, but your heart, your spirit, and your ability to love are timeless. And remember, the strongest couples aren't the ones without obstacles. They're the ones who face them together, hand in hand, step by step. If this video gave you hope or new ideas, please give it a thumbs up and share it with someone who needs to hear this message. And if you haven't already, subscribe to Men's Vital Health, Wellness Wisdom for more honest conversations about men's health, intimacy, and vitality after 60. I'm Dr. Emily Carter, reminding you, age and surgery don't define your future. With the right mindset, your best years of intimacy and connection may still be ahead of you.